Today I'm going to demonstrate ear acupuncture, a technique used in traditional Chinese medicine to stimulate specific points on the ear for healing. I'll be showing two methods, using acupuncture needles and ear seeds. Now I'm going to show the tools I'll be using. First, we have the acupuncture needles. These are thin and used to gently go into certain points on the ear. Then I have the ear seeds. They stick on and press the same points over time, which is good for people who don't want needles. Next are the alcohol wipes, which is used to clean the ear before a start so everything stays clean. I also wear gloves to keep everything safe and hygienic. And last, I have a marker which helps me point out the spots I'll be working on. Today, a patient came in and said they were feeling stressed, they feel off balance, and their energy has been really low. They also mentioned they've been dealing with headaches and some inflammation. For this procedure, I'll be using acupuncture needles to stimulate these points. I have my gloves for hygiene, alcohol wipes to clean the ear, and a marker to help identify the points. First, I'm going to clean the ear using an alcohol wipe. I'll start from the top of the ear and work my way down to the bottom. This helps remove any oils or bacteria and keeps the area clean for the procedure. Once I'm done cleaning, I'm going to let it dry before I begin. Now that the ear is clean and dry, I'm going to mark the points I'll be working on. I'll be focused on 3 specific points. Now that the ear is labeled, I'm going to put on my gloves and open the needles. Once the needles are ready, I'll carefully insert them into the marked points. I'm going to start with the Shenmen point, which is located in the upper central part of the ear. This is a small dip near the top of the ear, just inside the ridge. Shenmen is often used to calm the nervous system, reduce stress, and help with pain relief. Now that I found the Shenmen point, I'm going to insert the needle. I'll go in just 2 to 3 millimeters deep, enough to stimulate the point. It's okay to gently pull the ear to help with the angle. Next, I'll place a needle at point 0, which is located in the center of the ear. This point helps restore balance and supports overall energy levels. Now I'll place the last needle at the apex point, which is located at the very top of the ear, near the outermost edge. This point is often used to help reduce inflammation, relieve pain, and even assist with lowering blood pressure. Now that the needles are in place, I'm going to close the other needles and wait for about 20 to 30 minutes to let the points be activated. After I take out the needles, I'll tell the patient to relax for a few minutes. They should try to stay calm and rest. I also remind them to drink water and not do any heavy exercise right after the treatment. It's normal to feel a little sore where the needles were, but if anything feels uncomfortable or doesn't feel right, they should let me know. Otherwise, there's no special care needed after the needles are removed. Now I'm going to move on to the ear seeds. For these, I'll need a few tools. Alcohol wipes to clean the ear seeds for stimulations, and tweezers to carefully place the seeds on the points. Now first, I'll clean the ear with the alcohol wipe, starting from the top and working my way down. Then I'll let the ear dry before applying the seeds. Now I'm going to carefully pick up each ear seed with the tweezers and place them onto the marked points on the ear. With the help of my other hand, I'll gently press the seeds into the skin, ensuring they stay secure in place. Applying gentle pressure helps the seeds make good contact with the skin, which ensures they stay in place and continue to stimulate the acupuncture points effectively. After the procedure is done, I will tell the patient to let the ear seed stay in place for about 3 to 5 days. During this time, they should gently massage the seeds a few times a day to maintain stimulation. I also remind them to keep the area clean and dry.